Case of epilepsy in pregnancy, and the case is a 25 years old lady was taking tablet carbamazepine 200 milligram thrice a day for the treatment of grand mal epilepsy since last 2 years. She came to know about her pregnancy a week back. She was informed by her friend regarding the teratogenic effects of antiepileptic drugs. She became very apprehensive and confused regarding the continuation of antiepileptic medication. And the questions are whether she should continue antiepileptic medication that she was taking during pregnancy. Justify your answer. Enlist the antiepileptic agents causing teratogenicity. And will you prescribe any other pharmacological measures in this case? And if yes, mention along with justification. So the first question is whether the antiepileptic agents should be continued during pregnancy or not. In such type of the questions, the answer can be either yes or no, and we just see the consequences of both of these two answers. First, if yes, then obviously if the antiepileptic medication is continued and patient is well stable on this drug, then the chances of occurrence of seizure will be definitely very less. So it is unlikely to occur seizure. Okay, but anti-epileptic agents. Okay, I will not say all, but majority of the anti-epileptic agents they cause the teratogenicity. Now here in this case, carbamazepine has a very less chances of causing teratogenicity, and that is also there if it has been co-prescribed with valproate or other antiepileptic agent. Okay. Now if we look at the answer or the option no, then if a patient who is very well stable on the antiepileptic agents and you just suddenly stop the agent, then there are chances, I will use the word there are definite chances of the occurrence of the seizure. And the advantage is teratogenicity will be prevented. Okay, so in one side there is a rare possibility of teratogenicity, and on another side there is the definite risk of seizure occurrence. Okay, now here I want to, before come to any judgment, here I want to highlight one another point, and that is there is a definite chance or the definite occurrence that is called the spontaneous occurrence of congenital malformation. It is always there during the pregnancy, and the chances is 1 to 2%. While in case of the antiepileptic medication, the chances is 3 to 4%. So the chances doubles. But again, there are certain definitive agents, say for example sodium valproate. It is definitely responsible for the teratogenicity. But here in this case, carbamazepine, as I told you, the chances of occurrence of teratogenicity is very less. Okay. So, and additional, we have to again to balance between these two. One is the occurrence of 1 to 2% teratogenicity, and second is there is, if you just stop the drug, definitely you can say that in about 60 to 80% there are chances of occurrence of seizure, and seizure is not only harmful to the mother, but in case of the fetus also there are chances of hypoxia related brain damage, there will be mental retardation and many more. And that's why the answer is one has to continue the anti-epileptic agent during pregnancy. Okay, now here suppose in this case if the patient was on sodium valproate, then obviously it is better if one has to switch over to some other safer anti-epileptic agent. But here again I want to highlight one important point is that shifting from one anti-epileptic agent to another, it is always dangerous, and especially when the patient is stable on a particular agent. That's why in case of if a lady is taking sodium valproate for any particular type of the epilepsy, it has to be informed to the patient that first you switch over to the any other anti-epileptic agents and then you think about the pregnancy. That is the ideal line of treatment. Okay, and the next question is which anti-epileptic agents causing teratogenicity, and first and foremost, that's why I have shown in a very big arrow with big font, that is sodium valproate. It will cause spina bifida, neural tube defects and many other. It is a highly teratogenic drug, so it must be avoided during pregnancy. Followed by the phenytoin sodium, it will cause fetal hydantoin syndrome. Okay, various cleft lip, cleft palate, hypoplastic phalanges, nails, and many more. But definitely the occurrence of or the possibility of teratogenicity is less as compared to the valproate. Still, that is topiramate. It will lead to the orofacial defects and very less. I have to just mention because theoretically there are chances. That's why carbamazepine is there, but very less, and especially in combination. And that's why I want to highlight to another point. One is that as far as possible manage with a single drug, a single anti-epileptic drug during pregnancy. Second thing is that even with the single drug you use the lowest possible dose that is effective. And third, avoid the sodium valproate and topiramate specially. Okay, and the next question is will you prescribe any other pharmacological agents? Yes, that the majority of the teratogenic effects is due to this folic acid deficiency, and that is spina bifida neural tube defect. So the folic acid supplementation 1 to 4 milligram per day, it has to be given to the all lady to prevent the neural tube defects. And second, that vitamin K, now majority of the anti-epileptic agents, they are microsomal enzyme inducers, and that's why there is a deficiency of the clotting factors which are responsible for the synthesis of the vitamin K. And that's why one has to give vitamin K to mother, and especially in the last month. But there is you know that the vitamin K is available in the different form, that is phytonadione, menadione, but one has to avoid the menadione preparations because these agents they adversely affect the fetal outcome. And that's why only the phytonadione preparation, phytonadione 20 milligram daily in the last month, it is required. And additionally, the child is having a very sorry, the neonate is having a very less amount of the clotting factors, as well as its capability to synthesize this is also very less because of the deficiency of the vitamin K. So as soon as immediately after the birth, the injection vitamin K1, that is phytonadione 1 milligram intramuscularly should be given. Okay, so these two agents, folic acid and vitamin K, these are required. Okay, thank you very much.